everyone. Welcome to Shannon Sunshine Share on this beautiful Tuesday. Today we are outside of the Lantern of Madison. I'm here with my friend Todd Arganti, right?
Yep.
Said it right? From Elara Caring Hospice. And I thought it would be a great idea to have a conversation with Todd about hospice. What does it mean? Some of the ins and outs. I think that the word hospice is scary sometimes for people.
All the time.
Yeah. And over the course of my career, so 16 years as a nurse, I've had the blessing of working with so many hospice providers, not only in my personal life, but for my patients. And I'm a huge advocate for hospice services. So I kind of wanted to just kind of put out a little bit of education, just all about hospice care, what you guys do at Elara, and things like that, so that people have more of an understanding of what that word actually means. So thank you for being here today.
No, I appreciate the invite.
Absolutely.
I feel like a celebrity.
You are a celebrity.
Right? This is awesome.
Tell us a little bit about you, and tell us a little bit about Elara.
Sure. So I'm a respiratory therapist by trade.
Awesome.
You're a nurse by trade,
Yep.
so it's awesome to collaborate with another clinician in a different fashion.
Sure.
But at the end of the day, I mean, our role is really to take care of humanity, whether it's, through your community members in programs that you do, or in the home, or wherever they call home, to help them in their journey. So, the role of hospice really is to promote life and living. The word has a negative connotation to some, not all, but it's not all negative, right? So I wish we could change the name, but we can't. But Elara Caring, actually we're the 4th largest post-acute provider in the nation.
Wow.
So we're in Menor on Heisley Road is one of our locations. We have 226 locations nationwide.
Oh wow!
From
I didn't know that you guys were that big. That's
yeah,
awesome.
about 35,000 caregivers in 226 locations. We go from Texas to Massachusetts.
Wow.
So here we're part of the Midwest region. We're part of Ohio, Chicago, Illinois team. We've been in Menor for about 15 years.
Oh, awesome.
And my role is to meet with the good folks like yourself, clinicians, advanced practice practitioners, and mainly family members and patients,
Sure.
who are truly the number one customer for
Absolutely.
us, to make sure that they understand what the benefit can truly afford them.
Okay.
So yeah, that's a little bit about who we are and who I am and
Awesome.
how we approach it. So
Awesome. So when we say the word hospice, what is hospice? What's kind of an all-encompassing, you said, it's really about the health and wellness and care of the patient. So hospice is a program that, how much does it cost? Is it covered by insurance? Kind of, what would be like your definition of hospice services and how that's covered?
yeah, it's a great question. It's usually the number one question I get, or the number 2 question. How much is this going to cost me?
Yeah.
People say, geez, you sell hospice. I say, no, I don't sell hospice. I give it away for free.
Mm-hmm.
It's really one of the, and I use that term a little tongue-in-cheek, but the Medicare Hospice Benefit is really one of the, shall I say, nicest programs that the government has put together for folks that need extra support at, as they're on their journey towards end of life or not seeking curative care anymore. They're looking for comfort, they're looking for peace in psychosocial, emotional, and clinical support. And really, it's all encompassed under their Medicare Part A portion of the benefit. Even if you have an HMO plan, it reverts naturally to the Part A benefit. A lot of folks don't know that. Like, I have senior, Anthem Senior Advantage,
Yeah, I didn't
United
know
Healthcare HMO. It happens behind the scenes.
Okay.
It just kind of flips. So there's nothing anybody has to do. It's just how we build the service to the provider.
Okay.
And it's paid out at 100% under that benefit.
Okay.
And it includes a myriad of things,
Right.
depending upon the needs of the client.
Okay.
And so, we can get into those a
Yeah,
little bit
so
too.
what services are covered under the hospice benefit? Can you give us an idea or some examples?
Yeah, absolutely. So the benefit itself encompasses a wide array of things, right? So from medications that are related to an admitting diagnosis, home medical equipment or durable medical equipment that is there for support, for comfort, for need, and just to maintain the journey in a positive fashion. So we're talking about a low air loss mattress for better circulation and wound support.
Sure.
We're talking about oxygen, nebulized therapy for breathing. You have peri-care items, gloves, incontinence supplies, catheter supplies. Those are all kind of scary terms, but things that that are important to folks when they're on that path.
Sure.
And that's all covered. We take care of everything. It's wrapped up into the benefit. Our clinical teams assess for the need. They place the orders specifically along with the physicians that are involved. And then they provide it either during their visit or if they're in the home, the product gets shipped directly to the patient or the caregiver, or our caregivers bring it depending upon the scenario.
Okay.
Yeah, so it really is a full embodiment of care.
Yeah, absolutely. I mean, I'm amazed at how quickly, that this process can take place. I mean, I've had patients who have, the doctors recommended a hospice consult. I've had patients who were able to have that initial meeting with hospice and get signed up for the benefit in the same day, have equipment delivered the same day. I mean, I'm amazed at how fast, everything goes and how smoothly everything moves. And I know that takes a lot of work behind the scenes, and you guys do a great job with
and we've done it on a Saturday for
yes,
you guys.
Absolutely.
So
even on the weekend.
Yep.
So that's amazing. So let's talk a little bit about some of the myths of hospice. So I've had families tell me before that, when they think of hospice, it means like, that's it. I'm going to pass away very soon. But that's not the case, because I've had patients on and off of hospice services for years.
Absolutely.
Sometimes there's a need for it. Sometimes, we have a change in condition and we're feeling better, or, whatever the case may be. So can you talk a little bit about, let's talk about, people say, well, is hospice a place? Is hospice a service?
Yeah.
What is it?
Yeah, it's all great questions. So, and I get asked those a lot, and it's part of my role is to make sure when I meet with families or caregivers that they have a clear understanding of truly what that means.
Yeah.
And the hospice Medicare benefit, it's not a binding contract, first of all. So to your point, folks can sign up for hospice. I had a colleague once that said, the Medicare hospice benefit's the only benefit you can test drive, right? You can try it out. If you like it, if it works for you, if it's the right decision at that time, great, keep it. As long as you continue to qualify for it, the benefit is there and it's uncapped for episodes.
Okay.
So the first episode is lumped up into 2 90-day segments that equal 6 months. Then there's a nurse practitioner visit that we take care of that certifies the need again. Mm-hmm. And then they're uncapped episodes, unlimited, I should say, for that. So in order to continue to meet the benefit.
Okay.
Is hospice a place? Hospice is wherever care can be provided. So we care for patients in their home, in assisted living communities, independent living, skilled nursing, long-term care facilities. We just had a flyby. Transitional care units, LTACs, ICU. We
so
can
it's
do general
wherever,
inpatient.
Wherever the patient is, that's where you go.
Yeah,
that's where
it's like they say, home is where the heart is.
That's right.
Hospice can be wherever the home is, wherever they're calling home.
So I've heard a lot about people. People have asked, like, is hospice only for people that have cancer or like terminal illness? What can you say to that?
Yeah, so it's not just for cancer patients. In fact, I've been doing this going on 2 years, and the least diagnosis that I've seen has been cancer.
Really?
It has. The initial qualifying criteria is, you have to have a terminal diagnosis. You have to understand the philosophy that you're no longer seeking curative care or aggressive treatment. And there's some stipulations to that as well. And so, that's the initial criteria. So, folks that have underlying lung disease, chronic obstructive pulmonary disease, CHF, renal failure really is a big one.
Yeah.
Those are among the top that we see. And of course, cancer is folded in there. So
Okay.
yeah, it's not just a cancer diagnosis. But there's a lot of different diagnoses that are
Okay.
out there, right?
That makes sense.
So
That makes sense. And so it's really up to, the physician and the clinical team to determine, if that patient would qualify for the benefit. Okay.
always,
Perfect.
and sometimes, unfortunately, folks have multiple comorbidities,
Yeah.
and so then we work with the physician and the patient to find out. All right, so if they're on multiple medications for one and not for another, does it make sense to go this route?
Sure.
And would it benefit the client and their
Okay.
their caregivers if we said, all right, heart failure is the bigger problem here as
Sure.
opposed to
Okay.
something else.
That makes sense.
Yeah, so the clinical teams and our medical directors determine that,
Okay.
but it's just, it becomes a conversation and an opportunity to figure out what the best plan is moving forward.
Okay.
So instead of hospice, we talk about advanced care planning, because that's really what
Sure,
it is.
sure.
We're advancing the care plan forward and making sure that the needs are met.
Okay. That makes sense. Let's talk a little bit about medications. I've had patients ask me before, hey, if my mom qualifies for hospice, does that mean that all of her medications get taken away from her? I think that, that's something that I hear pretty commonly, that people, when they hear hospice, they think, okay, well, they're going to take me off all of my daily medications.
Right. Yeah. I hear that a lot too, and I'm sorry to keep saying that, but
Yeah. Well, that's okay. I mean,
you're doing a great job.
I'm asking the right questions.
Yeah, you are, absolutely. And
Good.
so, I get that question a lot, and our goal is to not strip away what is working for the patient.
Okay.
It's a collaboration. Again, it's advanced care planning. So how do we advance the care plan forward that makes the most sense? And if they're on medications that really aren't advancing the care plan forward that makes sense, then between the clinical team, the patient, the caregivers, and the physicians, they'll adjust whatever might make the most sense.
Sure.
Or if they're on two medications and it can be accomplished with one, they'll take that approach.
Okay.
But, I know I can only speak for our clinical teams and our RN case managers that go in. They rarely start removing medications.
Okay.
Because that sometimes will throw the body into a whole other, spin that we don't want. We want to maintain the best way forward for them and augment what your clinical team's doing. Say, for example, if we have a patient here, what your nurse practitioners are doing, what your physicians are doing, not remove everything and take over. It's a collaboration to advance that care plan forward.
Sure, that's great. That's perfect. So, yeah, and I try really hard to make sure that I, educate as best I can.
Sure.
But that's why it's really important that we have partnerships with folks like you, because, you guys are able to actually sit down and talk about the specifics for what every patient kind of needs and
Right.
what is important to that patient. So that's what I really love about hospice. It's very patient-centered. And they're very involved in the process and the decisions that are being made. So.
Yeah, and we learn from each other, right?
Yeah.
So, the collaboration that your team has here and the collaboration that we would bring to the table, or any hospice, then at the end of the day is patient focused.
Right.
So that's the
Absolutely.
goal.
I love it. I love it. So let's talk a little bit about, so what I see a lot of times, especially with folks that have a neurocognitive diagnosis or like dementia, what happens when they stop kind of desiring to eat or drink? What happens at that point? Is that a point where maybe it might be appropriate for a hospice consult?
Yeah, so dementia and Alzheimer's can be a little bit difficult from time to time, as you well know. Part of the advancement of that progression can come to that, right?
Yeah.
They no longer want to eat or drink or remember how to eat or drink. And at that point, part of the hospice philosophy, I think, is a good time to interject for a couple different reasons. A, being the fact that, we don't prolong or hasten death. Our job is to maintain the journey and make sure that the goals are met during that journey. So the body itself, the philosophy behind hospice is, allowing the body to progress in a fashion that it is wanting to.
Sure.
So we don't hasten or prolong that process. We make sure that that process for the individual and for the caregivers are as comfortable as possible.
Perfect.
So I talk to families all the time, mom, dad, they're not eating drink, they only eat a tablespoon, they don't want to do, and they want to force feed them. And as you know, being a nurse, sometimes that can be the worst thing to try to do.
Yeah.
But that's an emotional, it's hard to watch.
It is hard
to
watch.
See because
Very
as,
much.
As humans, we were just talking. You had a great taco salad for lunch.
Exactly.
And, I ate something for lunch I shouldn't have. But that we like to eat, right?
Yeah.
And so when we see that, I'm Italian, right? Come on, you got to eat. So, that's hard for us. But the other portion that we bring in when it comes to hospice is a medical social worker, right?
Okay.
So that emotional and psychosocial support is there not only for the client but also the family.
Yeah.
And so, they spend their time working through those types of scenarios. And our clinical team through education with the families as well. And, we see that when wounds happen as well. Somebody always wants to blame somebody for why the wound isn't getting any better. And it's part of the body decomposition. It sounds bad, and it's not easy to watch, especially if it's a loved one, or even if you're a clinician taking care of it. It's a tough scenario.
Yeah.
But part of that again is supporting and making sure they're comfortable, they're positioned, they have the right support surface to help that journey.
Sure, perfect. But yeah, I couldn't have said any of that better myself. I'm glad that you were able to be here today to kind of help bridge the gap on some of the questions or maybe the things that are floating around out there that some of those misconceptions. So you gave me some really great information today. So how can people get this information, and how can they get a hold of you at Elara, or just get some more general information about the services that you provide?
Sure. The easiest way is you can always contact Shannon. She has our information as well. But the easiest way, if you go on elara.com, ELARA.com, there's links to all of our locations. They can research who we are. They can look us up on CMS. So there's a governmental website, right? Medicare.gov. They rate the hospices, and so we're on there. We're nationally ranked, really kind of second to none, especially in our region. That's
awesome.
Probably the easiest way to get it started.
Perfect. Well, I can say that all of the interactions with your staff have been amazing. They're in our building taking care of our clients, and they're just very passionate, very educated, very calming presence, and just it's been an overall great experience for us, for our families, and our clients. So I want to thank you for that.
Thank you.
And thank you so much for being here with us today.
Perfect.
And I will look forward to seeing you all next week. Thank you so much for tuning in, and have a great day. Bye.